Extract 1. Questions 1 to 12. You hear a psychologist talking to a parent called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mrs. Mihiraa. Thank you for coming in today. I understand you're concerned about your son.
Good morning, Dr. Tim. Yes, I am. I'm really worried about him. He's changed a lot lately.
I see. Can you tell me a bit more about these changes? When did you first notice them?
Well, it started about 6 months ago. He became more withdrawn, spending a lot of time in his room. His grades started dropping, and he lost interest in his hobbies. He's also been with a new group of friends that I don't know very well. I thought it was just a phase, but then I found drug paraphernalia in his room. I've noticed changes in his appearance too, like he's not taking care of himself as well as he used to.
I see. That must have been very upsetting. Can you tell me more about the drug use? How often do you think he's using it? Are there any particular triggers or situations that seem to lead to increased use?
I don't know exactly how often, but I think it's becoming more frequent. He seems to use it when he's stressed or upset, or when he's hanging out with a new group of friends. I've noticed he's been borrowing money more often, and I suspect he's using it to buy drugs. He's also become very secretive and defensive, even with me.
I understand, Mihiraa. Can you describe a typical day for him? What does his routine look like?
He sleeps a lot during the day and stays up late. He's lost a lot of weight, and he doesn't eat properly. He's also become very irritable and argumentative.
Has he experienced any physical symptoms, like rapid heart rate, difficulty breathing, or changes in appetite?
Yes, actually. He's complained of a racing heart sometimes, and he's lost a lot of weight, as I mentioned.
Mihiraa, have you tried to talk to him about it?
I have, but he gets defensive and shuts down. I've tried to set limits and consequences, but nothing seems to work. I'm at my wit's end, and I don't know what to do anymore.
It sounds like you've tried your best to manage this situation. Have you sought any professional help for him so far, Mihiraa?
We've seen his pediatrician, who suggested we see a counselor. But I'm worried it's more than just counseling.
It's understandable to feel overwhelmed, Mihiraa. Drug use can be a complex issue, and it often requires a multidisciplinary approach.
I know it's going to be tough. But how to get started?
I think it would be helpful to conduct a thorough assessment to understand the extent of the problem. Mihiraa, we can start with a detailed history and physical examination. I might also suggest some psychological tests to evaluate his mood, cognition, and personality.
All right.
Depending on the results, we might consider a substance abuse screening or a toxicology screen.
I think it would be a great idea. And what will happen after that?
Mihiraa, if his symptoms are severe or if he's experiencing withdrawal symptoms, hospitalization might be necessary for detoxification and stabilization. This would provide a safe and controlled environment for him to recover, and we can also monitor his physical health closely.
That sounds like a plan.
In addition to medical treatment, we will definitely need to involve counseling. I can provide individual counseling for him, and family therapy sessions can also be beneficial. Mihiraa, I understand this is a difficult time for you, and I want to assure you that we will work together to develop a comprehensive treatment plan for your son.
Thank you, Dr. Tim. I appreciate your help.
Extract 2. Questions 13 to 24. You hear an orthopedic surgeon talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, have a seat. So, what brings you in today?
Good morning, doctor. I fell off the motorbike 3 days ago. The impact was quite hard, and my shoulder has been aching terribly ever since. I landed hard on my right side. My shoulder hit the ground hard.
I see. Can you tell me a bit more about what happened?
Definitely. Well, I was riding home from work, and suddenly a car cut me off. I tried to avoid it, but I lost control, and that's how the accident happened. I've been experiencing significant pain in the right shoulder since then.
Okay, and when did the pain start?
Pain started immediately after the fall. The pain was excruciating, sharp, and intense. It felt like a knife stabbing me in the shoulder. The pain has gradually eased over time, but now it's a constant, dull ache that never really goes away. I'm unable to lift my arm without experiencing significant pain, and the discomfort is so severe that it's disrupting my sleep.
Mihiraa, have you taken anything for the pain?
Yes, I've been taking ibuprofen 400 mg tablets, but they're not really helping. The pain is constant and getting worse.
All right, let's have a look at your shoulder. Can you remove your shirt, please?
Sure, I will.
It looks like there's quite a bit of swelling and tenderness in your shoulder. I'm concerned there might be a fracture, so I'll need to run some tests to get a better idea of what's going on. I know this is worrying, but we'll get to the bottom of this together.
Okay, what kind of tests would you like to do?
I'm going to order some X-rays to determine that, Mihiraa. We'll also do an MRI to get a better look at the soft tissue. These tests will help us determine the extent of your injury and the best course of treatment. I'll schedule these tests for you as soon as possible.
Okay, doctor.
Based on what I can see, it looks like you've dislocated your shoulder. We'll need to reduce it back into place.
What does that mean, doctor?
It means we'll need to manipulate your shoulder to put it back in the correct position. It might be a bit uncomfortable, but it's a common procedure. It's important to get your shoulder back in the correct position. I'll administer a local anesthetic to numb the area before we proceed.
Okay, numbing the area is a good idea. I don't wish to bear any more pain.
Absolutely. Mihiraa, after the reduction, we'll immobilize your shoulder with a sling for a few weeks to allow it to heal. You'll also need to undergo physiotherapy to regain strength and mobility.
How long will I be off work?
It's difficult to say at this stage. It depends on how quickly your shoulder heals. We'll reassess in a couple of weeks. In the meantime, it's important to immobilize your arm to allow for proper healing.
All right. That's fine.
I'll prescribe you some stronger painkillers until the swelling goes down. You can take naproxen every 4 hours as well. It's important to avoid any strenuous activity for the next few weeks. I recommend wearing a sling to support your arm and prevent further injury.
Okay, doctor. Thank you.
We'll schedule the MRI for tomorrow. In the meantime, try to rest your shoulder as much as possible. We can discuss the treatment plan once we have the results.
Thank you, doctor.
That is the end of Part A. Now check the answers.